You are not at risk of heart disease because you lack discipline. You are at risk because you have been taught a version of the truth that sounds convincing, feels responsible, and quietly leads you in the wrong direction. For years, you've been told that cholesterol is the enemy, that fat in your diet becomes fat in your arteries, that if you lower your numbers, take your medication, and follow the rules, you are protecting your heart. And so you do exactly that. You choose low-fat foods. You avoid what you were told to fear. You trust the process. But here is the part no one says clearly enough. You can do all of those things consistently for years and still be building plaque inside your arteries without ever knowing it. Not because you are careless, but because you are solving the wrong problem. You are managing a number on a lab report, while the real process that damages your arteries continues underneath, untouched, unchallenged, and completely misunderstood. I want you to picture someone real, not a statistic, not a case study, but a man with a life that feels familiar. His name is Daniel. He's 59 years old, a father, a husband, the kind of person who takes responsibility seriously. He doesn't ignore his health. He walks most mornings, even when he doesn't feel like it. He switched to what he believed was a heart-healthy diet years ago, cutting out red meat, choosing low-fat products, cooking with vegetable oils because that's what he was told was better. He takes his medication every day without missing a dose. Every 6 months, he sits in the same chair across from his doctor, listens carefully, asks questions, follows instructions, and every time he hears the same reassuring message, "Your numbers look okay. Keep doing what you're doing. We'll keep monitoring." Daniel trusts that. He believes that consistency means protection. But one afternoon, sitting quietly at home, he feels something shift. Not sharp pain, not something dramatic, just a heavy pressure spreading across his chest. Unfamiliar and unsettling. He pauses, trying to make sense of it, telling himself it will pass. It doesn't. Within minutes, that pressure deepens, his breathing changes, and a quiet fear begins to rise. This wasn't supposed to happen. He did everything right. And yet, in that moment, his body is telling a completely different story. One that had been developing silently for years without ever showing up clearly in the numbers he trusted. For more than 2 decades, I have worked directly with patients like Daniel, reviewing their lab results, analyzing their imaging, and tracking what actually happens inside their arteries over time. I have seen men who followed every guideline with precision, who trusted the standard advice, and who still showed progressive plaque on their scans. This is not rare. It is consistent, and it forces a difficult but necessary conclusion. The conventional model most people rely on does not fully explain what is happening inside the body. When you look beyond surface numbers and examine the underlying biology, a different pattern emerges, one that cannot be ignored, and one that changes how this problem needs to be understood and addressed. You were taught that plaque is simply fat building up inside your arteries, like grease collecting in a pipe. That idea is easy to visualize, and that's exactly why it's so powerful. But it's also deeply misleading. Plaque is not just fat accumulation. It is a biological response. It is your body reacting to damage. Your arteries are not passive tubes, and cholesterol is not the original problem. The real issue begins when the inner lining of your arteries becomes irritated and inflamed. What follows is not a clogging process, but an immune process. Your body is trying to repair something that keeps getting injured. And until you understand that plaque is driven by inflammation and oxidation, not simply by the amount of cholesterol in your blood, every solution you've been following is aimed at the surface, not the source. Inside your arteries, there is a lining so thin and delicate that you would never notice it. Yet it controls everything about how your blood flows. This layer is called the endothelium. And it is not just a barrier. It actively regulates tension, signaling, and inflammation. When it is healthy, your blood vessels remain flexible, smooth, and responsive. But when this lining becomes irritated, even slightly, the entire system begins to change. That irritation can come from multiple sources. Things as ordinary as what you cook with, what you eat daily, or even what you use in your mouth every morning. The damage is not dramatic. It does not feel like anything, but it is persistent. Once that irritation begins, your body responds the only way it knows how. It sends immune cells to the area to repair what it perceives as injury. These cells are not harmful on their own. They are doing their job. They are there to protect you, but the environment they enter determines what happens next. If the bloodstream is carrying stable, undamaged particles, the process resolves quietly. The cells clean up and leave. The system returns to balance. But if something else is present, something altered, something chemically damaged, the response does not resolve. It escalates. And that is where the real problem begins. Not with cholesterol itself, but with what has happened to it before it ever reaches the arterial wall. What changes everything is the condition of those particles when they arrive. LDL cholesterol on its own is not inherently dangerous. It becomes a problem when it is oxidized, when it has been chemically altered by an environment that promotes damage. In that state, it is no longer recognized as normal. When immune cells encounter oxidized LDL, they don't ignore it. They consume it, and they continue consuming it far beyond their intended capacity. These cells begin to swell, filling with damaged lipids, losing their original function. Instead of cleaning and leaving, they become trapped within the arterial wall. Over time, they transform into what are known as foam cells. This is not a one-time event. It is a cycle. More damaged particles arrive. More immune cells respond. More cells become dysfunctional and accumulate. What began as a controlled repair response turns into a sustained inflammatory process. As these foam cells build up, they signal for more immune activity. The area becomes increasingly inflamed. Layers begin to form, and eventually, calcium starts to deposit, hardening what was once a flexible, living tissue. This is the structure we call plaque. Not a passive buildup, but the result of repeated injury and a response that never fully resolves. So the question that actually matters is not how much cholesterol you have, but what is driving that damage in the first place. And this is where most people feel a shift, because the answer is not hidden in rare conditions or extreme lifestyles. It is built into ordinary daily habits that look completely harmless on the surface. The first is refined seed oils, sunflower oil, corn oil, soybean oil, canola oil. These are everywhere. In home kitchens, in restaurants, in nearly every processed food. On a label, they appear neutral, even healthy, but at a molecular level, they are highly unstable, especially when exposed to heat. Every time they are used in cooking, they undergo oxidation. They break down and form compounds that directly promote lipid damage in the bloodstream. What enters your body is not the original oil, but an altered version that increases the likelihood that your LDL particles will arrive already damaged, already primed to trigger the immune response you just learned about. The second is the long-standing belief that lowering fat intake automatically protects your heart. For decades, people have been encouraged to reduce saturated fat, avoid animal products, and replace them with low-fat, high-carbohydrate alternatives. But this shift changes your internal chemistry in ways most people never consider. Your protective cholesterol, HDL, often decreases. Triglycerides rise, and the LDL particles that remain tend to become smaller and denser, which makes them far more susceptible to oxidation. You are not simply reducing fat. You are altering the balance of your entire lipid system in a way that can make it more fragile, not less. The third is something almost no one expects. Antibacterial mouthwash. Inside your mouth lives a community of bacteria that plays a critical role in converting dietary nitrates into nitric oxide, a molecule that keeps your blood vessels relaxed, flexible, and protected from inflammation. When you use antibacterial mouthwash regularly, you disrupt that process. You reduce nitric oxide production, increase vascular stiffness, and remove a layer of natural defense your body depends on. It feels like hygiene, but biologically, it is interference with a system designed to protect your arteries every single day. And this is the part most people are not prepared to hear. Even if you recognize all of this and decide to change everything starting today, it still may not be enough on its own. Because once plaque has formed, your body does not simply reverse it because the environment improves. The system becomes locked in a pattern that sustains itself. The cells that absorbed damaged cholesterol lose their ability to release it efficiently. The signals that would normally clear that buildup begin to weaken. Over time, calcium starts binding into that structure, making it harder, more rigid, more resistant to change. What began as a response becomes a condition. This is why so many people feel like they are doing better but not actually getting better. They clean up their diet. They become more consistent. And yet the underlying structure inside their arteries remains, not because their efforts are useless, but because they are now pushing against a process that has its own momentum. It is no longer just about removing the cause. It is about unlocking a system that has adapted to dysfunction. What this means is that improvement requires more than avoiding what causes damage. It requires actively engaging the mechanisms that restore function at the level where the problem exists. Not broadly, not generally, but specifically. A targeted daily protocol that addresses each step of the process you've just seen. The first component is nitrate-rich vegetables, particularly arugula and raw beets. These are not included for general health. They serve a precise function. They supply the raw material your body uses to produce nitric oxide, a molecule that relaxes the smooth muscle inside your arterial walls, improves blood flow, and directly reduces the inflammation that initiates plaque formation. This is not a one-time effect. Nitric oxide is short-lived. It must be replenished daily to maintain its protective role. The second is high phenolic extra virgin olive oil. Not all olive oil functions the same way. The type that matters here contains a high concentration of specific phenolic compounds that have been shown to influence cellular behavior. One of their key actions is supporting the activity of transport proteins responsible for moving cholesterol out of cells. This directly addresses the issue created by foam cells, helping restore the ability of those cells to release what they have accumulated instead of remaining trapped in a dysfunctional state. The third is pomegranate in its whole form, specifically the seeds. The compounds within pomegranate have a strong effect on oxidative processes in the bloodstream. They help protect LDL particles from becoming damaged before they reach the arterial wall. This interrupts the cycle at its earliest stage, reducing the likelihood that immune cells will react in the way that leads to plaque formation. The fourth is vitamin K2, particularly in the form that supports activation of proteins responsible for managing calcium placement in the body. This is critical because once calcium becomes embedded in plaque, the structure becomes harder and more difficult to influence. Vitamin K2 supports the movement of calcium away from arterial tissue and toward bone, where it belongs, helping to address one of the key factors that makes plaque resistant to change. Each of these elements is not a general recommendation. Each one is tied to a specific mechanism. Together, they form a system that does not just avoid harm, but actively works to reverse the conditions that allowed the problem to develop. And this is where most people lose the benefit without realizing it. They hear a protocol like this and translate it into intention instead of execution. They do it during the week, then relax on the weekend. They stay consistent for a few days, then break the pattern when life gets busy. But the biology you are working with does not respond to effort. It responds to continuity. The mechanisms involved here are short-lived and require constant signaling. Nitric oxide fades within minutes. The cellular transport processes that move cholesterol out of tissue depend on repeated daily activation. The protective effect against oxidation only exists when those compounds are consistently present in your system. This is not a plan you follow occasionally. It is a signal you send every day. When that signal stops, the process does not pause. It resets. Change does not happen all at once, and it should not be expected to. But when the underlying biology begins to shift, there are patterns that tend to appear, and recognizing them matters because it replaces guesswork with something more grounded. In the first week, what most people notice is subtle. A slight increase in morning clarity, a sense that energy is more stable, not dramatically higher but more consistent. This reflects improved blood flow at the micro level, where oxygen delivery begins to normalize. By the third week, something more measurable often emerges. Blood pressure readings begin to move, sometimes only by a few points, but consistently downward. Inflammation markers, if they are being tracked, start to show a shift. By the second month, the changes are no longer just functional. They begin to affect structure. The processes that remove accumulated material from cells are being activated repeatedly. And over time, that repetition matters. And by the third month, what was once a stable pattern may begin to look different. Not because everything has been reversed, but because the direction has changed. And that is the point where real progress begins. If you want to know whether this is working, you cannot rely on vague impressions or on total cholesterol alone. Total cholesterol is too broad to tell you what is actually happening inside the arterial wall. What matters is the quality and behavior of the particles involved. That means looking at markers such as oxidized LDL, ApoB, small dense LDL, triglyceride to HDL ratio, and, when appropriate, lipoprotein A. These give a far more accurate picture of risk than a single standard panel. And beyond blood work, imaging matters. A coronary artery calcium score provides something most people never get early enough. A direct measure of calcified plaque burden. Not a guess, not a probability, but a number that lets you see whether the process is continuing, slowing, or finally beginning to change. You came into this thinking about cholesterol, about numbers, about control through restriction. But what you've seen is something deeper. Your body is not randomly failing. It is responding, adapting, trying to protect you in a way that makes sense biologically, even if it doesn't feel that way from the outside. When you understand the real process, the focus shifts. You stop chasing numbers and start influencing mechanisms, and that is where change becomes possible. But understanding is only the first step. Seeing what is actually happening inside your own arteries changes everything. In the next video, I'm going to walk you through how to measure your coronary calcium score, how to interpret it, and what it really means for your risk moving forward.